The following segment is sponsored by Northern Nevada Health System.
We are here with Dr. Alex Meyer with the Northern Nevada Medical Group. You are an interventional cardiologist.
You got it.
What does interventional mean with the cardiologist?
So there are general cardiologists that do things like interpret imaging studies and treat patients with medications. What I do primarily is fix blockages in the blood flow to the heart.
And we're talking about this, coronary artery disease and blockages. How common is this, doctor?
So it becomes more common as we age, but for a man age 40 years old, the chances of developing the disease over a lifetime is about 1 in 2. And then for a woman that age, it's about 1 in 3.
So, I mean, with the symptoms, when should we be concerned? And we'll get to what the symptoms are, but how concerned should we be over this?
So the problem with coronary artery disease is it typically doesn't produce any symptoms until it becomes severe. So you may have mild coronary artery disease and not even know it.
What, I mean, not at all, like we experience maybe lethargy or just kind of not inclined to want to get up and go type thing, or it just seriously no symptoms?
Typically no symptoms at the mild or moderate stage. Now, once it becomes severe, you typically do experience things like chest pain, trouble breathing, generalized fatigue, like you mentioned, or some other symptoms.
That's scary that it's undetected for so long until it's almost sometimes too late until we see you.
Yeah.
What treatments are there for this disease?
So we always treat coronary artery disease with medicines, both to slow progression of the disease and to treat symptoms. And then in some cases, people need things like stents, which I do, or even bypass surgery.
The stent technology has improved a lot, I'm guessing, over the last 10, 12 years. I think of stents, I always think of Dick Cheney, our former vice president, where he had those issues all the time.
Right.
And they were so public. Has that technology improved a lot?
Yeah, it's improved dramatically. Everything we use now, 10 years ago, wasn't even available. So the technology is great, and it makes my job a lot easier.
And can it be prevented, this coronary artery disease?
Yeah, prevention is really key. There are some things we do to try to detect it at an early stage. The cornerstones of prevention would be a healthy lifestyle, things like eating a good diet and exercise regularly. And then some people at particularly high risk, we also use medications for prevention.
We hear that cigarette smoking is so bad for us. Does that add to clogged arteries for this?
Cigarette smoking is definitely a huge risk factor for coronary artery disease.
All right. Well, doctor, thank you. And welcome to the practice. You've been here since July.
Yeah. Thank you. It's great to be here. I love the city.
And the staff is so cool here, right? Everyone's so friendly.
They're all very nice. Yeah, it's really been a great place to work.
Doctor, thanks for your time. Really appreciate it.